Next, I'd like to speak to you about digoxin, Lanoxin. What sounds more dangerous to you? Taking digoxin, taking a little dig, or taking a sodium potassium ATPase pump inhibitor? That's what digoxin is, all right? Digoxin works by increasing contractility because there's an increase in the intracellular calcium, all right? The other things that cause digoxin toxicity, besides the pill, besides the Lanoxin pills, are the plant products, foxglove, oleander, lily of the valley. Digoxin toxicity is often unintentional in older people that keep taking their pills and the level gets higher and higher and higher. You know, patients that have renal insufficiency are more prone to becoming dig toxic. Patients that have underlying ischemia or hypokalemia are more prone to becoming dig toxic. Patients who are on other medications like calcium channel blockers, like beta blockers, cyclosporin, Lasix, all these things, predispose the patient to dig toxicity. So the common scenario is an older person that's just following the doctor's orders normally, taking their medicine as prescribed, and before they know it, they're dig toxic. You can always order a digoxin level if you suspect dig toxicity. I would also order a couple other things. I would order the renal function, I would order the serum electrolytes, and of course, EKG. All right? You'll get the digoxin level back, but the main thing is to treat the patient's clinical symptoms and EKG, not the absolute number on the dig level. The patient's symptoms are the most important. What arrhythmia will we see with digoxin? Well, you can see almost anything. You can see all the bradycardias, PVCs, heart blocks. You could also see tachyarrhythmias. You could see atrial flutter with a 2-to-1 block. What did we say that heart rate was this morning, earlier? 150. You could see torsades. You could see VTAC. Often these patients will complain of a little abdominal pain or discomfort and be nauseous, but they won't have any abdominal tenderness to palpation. Okay? The potassium level is so important to check because severe dig toxicity can be the cause of acute hyperkalemia, elevated potassium. So what's the treatment? Well, we're going to stop the digoxin. Okay. Want to give some charcoal? You know, if it's an acute ingestion of several tablets, I would absolutely want to give charcoal. Do you want to correct the fluid and electrolytes and keep the potassium from being 6.0? Absolutely. All right? Remember that the intracellular calcium levels are already high with digoxin toxicity. So giving additional calcium may not be the best thing for treatment of hyperkalemia. All right? If someone's in VTAC and has no pulse, well, we have to use electricity, don't we? If someone is in VTAC and is unstable and dig toxic, we have to use electricity, but we realize we're in a very difficult situation because electricity can sometimes precipitate further arrhythmias, such as asystole and VFib. So this can be very dangerous. The treatment for the bradycardia with dig is the same as always. It's atropine if they're symptomatic, followed by some type of pacemaker. If you got torsades, remember, magnesium, right? Now, there's a couple additional agents you can use for VTAC in the stable patient with dig toxicity. So we're talking stable patient, dig toxic, VTAC, think lidocaine and think phenytoin. All right? Now, there's a newer medicine called digobind. What is a digobind? These are antibodies made to the digoxin. So this is very effective in treatment of severe digoxin toxicity. This is reserved for patients with unstable arrhythmias, either too fast or too slow. If they're unstable arrhythmias and they're having chest pain or shortness of breath, in addition to the other therapies we just mentioned, add the digobind. Okay? Okay? Think about digobind also when the potassium level is very high, because that indicates severe digoxin toxicity. And some authors recommend considering using the very high digoxin level over 10 as another indication for digobind. So if the patient's clinically unstable, besides stabilizing the patient, digibind. And that concludes our discussion of Digoxin for today.